we are going to start.
Yep, yep. So let's go ahead. And yeah, so things that, just so you know, what I found out yesterday up at the corrosion engineers up in Canada, it was, 5.5 hours up there, 5.5 hours back, 5.5 hours, got back at 11 o'clock last night. But we were looking at, Sammy Nimbisi.
Yeah.
Yeah. So Sammy had sent some implants, titanium implants, because we're having these problems, like I presented in Istanbul, with titanium implants, right? Or at least we're seeing with the FDA and complaints. So brought some up, and we were looking at that, and and I have some of those to show you here. But as the abutment seemed to be where the problem was with the titanium, and that's where we're seeing the corrosion, and so we can discuss that.
We're already on. So let's go. I like that. We're going to talk about everything. So, um, Scott, it's been a while since I've done one of these podcasts. Sometimes I always feel that there's just too much information out there. So, biting into healthcare, I started about 3, 4 years ago during the pandemic, had nothing else to do.
Mhm.
And the idea was just to get ideas out there with a timestamp on them that needed to get out there. The sooner the better for, people to be aware of certain ideas and concepts. And after I saw your lecture in Istanbul, I of course I'd known around metal hypersensitivities. I know the work of Linda Nelson, and but to see the way that you explained this, being an orthopedic surgeon, and the emails that you sent to me, I just want more people to know about this. So,
Mhm.
just a little bit about you. If you want to just explain people who you are. So, of course, you went to Washington State University. You're an orthopedic surgeon, but explain a little bit in detail. How you started your career, what you learned, what you did, and where you are today, just so people know who you are.
So yeah, I mean, briefly, my dad was an anesthesiologist. He was chairman of the board of the hospital here, looking at medicine. Really, after I looked at foot and ankle side of things, and really got excited about that, and so went into that, and so that's what I do, and put a lot of implants in patients over the years, metallic implants, because that's what we had.
But you're talking
Uh huh.
foot and
Question.
ankle, right? You're a foot and ankle specialist.
Correct, correct. Foot and ankle specialist. Yep. And right now, I'm working with a lot of people that work, basically the patients and the docs, spine surgeons, head and neck surgeons, and others, because they don't understand a whole lot of the metal hypersensitivity or metal reaction thing either. We were never trained, about that in our training, unfortunately. And I think that needs to change. That's one of the probably the biggest things that needs to change is that.
So,
Yeah.
and in your what your career was 30-year career, right? Doing
Mhm.
foot and ankle surgery. So let's just say, I'm an implant dentist. So my implants go in the jaw. I've been doing that for about 25 years. The industry's been doing it for about 50, 60 years since Brånemark invented the titanium implant. And
Mhm.
there's hundreds of millions of people around the world with titanium implants in their mouths. And I could only presume even more with pins in their ankles and feet because it's a very common fracture, right?
Very well, or surgery that we do to reconstruct the foot. Like a lot of my surgeries weren't just fractures; they were reconstruction where, and I'll show you some of those slides, but where it's 7, 8 hour long surgery to straighten the feet out to allow people to walk again without pain. The goal.
So, just to set the stage before you start showing these slides, and of course, I'll be putting this out on YouTube as well, on my YouTube channel. Um, I've always paid attention to the science and the evidence and, things that I learned in my training in 1998 when I learned how to do implants. We were always focused on the osseointegration of these fixtures. So, do they integrate? Does the bone, and I remember discussions 30 years ago, is it fibrointegration? Is it osseointegration? And then the different coating of these implants to improve the biology and the osteoinduction or conduction of bone formation against the surface, because we wanted these things to stay and to last. Was that the same with you? Was that the major concern?
Well, when you're dealing is for me, no, not as much. We wanted the bone to be able to get compression with the screws to hold the bone pieces together so they can heal. And
So
once the
yours are
bone's
more like,
healed,
let's
we're
say,
done.
just retention plates. So like basically to join a fracture, let's put it that way, because so the only thing going in the bone marrow per se would be the fixation screw, correct?
Correct. Correct.
Okay.
So
Nonetheless,
yes.
this
So
would this would be put inside the body anyway, right? Sitting on the below the periosteum, above the bone, correct?
correct. Above the plate is above the
Above the
periosteum. The
periosteum.
screws go through.
All
Yes.
right. So
Yes.
still there's a lot of irrigation, innervation, all of that. Now, and then I remember, about 15 years ago, became a bit more concerned about how we could make the soft tissue integration and all of that. No one was ever thinking about anything remotely near metal hypersensitivity. And the first time I started actually thinking about, hang on, the quality of the product was in another podcast I did a year ago with Dirk Dudek from the Clean Implant Foundation. And he asked me to be an ambassador for this organization about 7 years ago. And the first time he even mentioned the concept, it's like, what the hell are you talking about? So, because everybody knows these implants are sterilized with gamma radiation, but they're not always clean. So during the packaging process, surface contaminants, plastic, organic, inorganic, leftover metal from detergents, all this stuff from the manufacturing process, and the doctor or surgeon they don't know about this. We have to trust the industry that this is good, right? And here we are putting this with the best of intentions in our patients. So I I got really upset the first time I started understanding this. How did you feel when you started understanding this stuff as well?
Oh, I was the same way. I think you know, in the mouth and the dental world, I mean, I think you have to even have higher standards because we already have bacteria and all this there, and we're in a quote sterile environment in the foot and ankle and other parts of the body, but you still have to have a clean device, excuse me, to get going with, otherwise potential problems.
And
So
so,
yeah.
like this metal hypersensitivity thing, honestly, I got this email from you about a year ago, and I read the email. Very polite email, a very long email, very well structured email from you. And from our mutual friend Jack Cole, I think, the chairman of the IOAMT. And I read this email and I just went, oh my God. And so I really want you to start sharing, your slides and your deck with the people that are going to watch and listen to this. And just a word of caution to all surgeons using metal and titanium. This doesn't affect everybody, all right? It's not an everybody problem. But so there's no fear mongering going on here. But for those patients that do have a lot of health issues that no one's figuring out, this could be that hidden or missing link that no one's really connected. Would you agree with that statement?
I would totally agree with that, and I think we have to be metal aware. We have to be understand the potential issues with metal. And no, it's not everybody by any means, but there are certain individuals that are definitely affected quite severely in some cases.
That's what I want. I mean, look, I've always had, friends that can't handle, let's say, any type of metal earring. They can only have specific gold earrings, otherwise their ear flares up. Or those girls that want to have the piercing in their belly and they get these some do, some don't. The large majority don't, but some really do. Because there's no test for this, obviously. We don't test our patients for metal hypersensitivities. Luckily, at the White Clinic, we have been for almost a decade now. But listen, let's get into it. Um,
Okay.
just I would liken it also to this. I'm 52. You're probably the same age as me. but
I'm 62.
but uh, but
Got a few years.
when I was a kid, man, no one ever heard about gluten intolerance, right? No one was ever gluten. I mean, it wasn't a word. I think the first time I heard the word gluten, I must have been in my 30s. To say what? There's a whole food industry around now, the gluten intolerant and the non-gluten and dairy free and all of that, because people have become aware that certain foods are bad for them. And I would liken metal hypersensitivity to that discussion. But at point of care, no surgeon is asking the body if it's hypersensitive or not. Would you agree to that?
I would agree with that. A quick note on the gluten and everything too, with some of the breads and other things, is that a bunch of these breads have soy in them, and soy is high in nickel. So you have to look, it may not
Mm.
just be gluten, it can be a nickel allergy
Oh my
that,
God.
like, I have this. And
That's,
there's only a certain few breads that I will want to eat because I will have issues. And,
I
kind of sinus issues,
that is
draining that.
unbelievable. That is unbelievable. I stopped using deodorant with aluminum, that Americans say it, already 25 years ago. I was, aware of that problem.
Right.
But yeah, metal in food, I hadn't thought about that one. So listen, Scott,
Oh, it's very, very big. I mean, that's a whole nother discussion.
that's
You know,
it's honestly it's scary. It is scary. So let's get started. I think it's I'll jump in every now and again, but please do share your deck with us because I was blown away by your lecture in Istanbul, and I think more people need
okay.
to.
And like I said, I just had a meeting with our corrosion engineer professor we were working with up in Canada, and just some new data just came out yesterday with some of these electron microscope pictures that we have and this type of thing. And so it's very exciting finding these things out, and also related to mercury and amalgam and that type of thing too. So let me share my deck, and then we will get going. And so I'll kind of go through this briefly here. And this is just me and the presentation that I presented down in Istanbul. And this is some of the hardware I'm talking about. These can be very intricate cases, a lot of metal I put on my patients over the years. And, surgeries are very long, 30 plus years. We talked about thousands of metallic implants. And then a couple decades ago, I started having an awareness, like you were talking about, as far as some of these things. And I was having patients come back 15, 20 years later to have metal removed with significant changes after I removed the metal. So I gave that more of an option to my patients about 10 years ago. Say, hey, we put this metal in. It's there for temporary. In Europe, they use it for temporary fracture fixation. In the U.S., we just kind of put it in, and it stays in because it takes time to get it out, and patients are busy with life. And so I said, my recommendation, you don't have to, you can do what you want, but my recommendation, get it out after the bone's healed. We don't need it anymore. It's just sitting there. Potentially you can develop a reaction as time goes on, as years go on. So I removed over 1,000 metallic implants in over 400 patients in the last 10 years of my career. Multiple presentations, over the years here. It started in New Zealand, Australia, and then last year was Egypt, and then, excuse me, Istanbul this year. But what I'm presenting is cause and effect, and essentially where I place the metal implants, and these are almost all placed by me. And then these certain symptoms develop. The question is, you have to know the right questions to ask. And that's what I didn't know. And that's what I've been learning over the years. And that's what I think a lot of physicians and dentists and all this don't know. What questions do you ask? It's not just local, it's systemic, and is I think a much higher likelihood of having systemic issues than local issues, potentially, depending on the implants involved here. So then I removed the implants, and symptoms then improved or resolved. In the last vast majority of time, these symptoms have resolved. So, and local swelling, rashes, electrical sensations in the areas, that type of thing, erosion of bone around implants, which can be, we're worried about, especially in the titanium realm there in the dental implants. And this was just from two stainless steel screws in the foot, and she was allergic to nickel. And this rash resolved after removal of those. So again, systemic.
Do these kind of patients do these kind of patients also have stuff in their mouths, metal in their mouths? And do you?
The majority of them did. When I started asking the questions, and me being a foot and ankle surgeon, starting to ask patients about, dental metals and that type of thing, some of the docs thought I was kind of crazy, but guess what? My recommendation is that's what we need to do, because as you'll see in this presentation, we can get potential interactions or potentials. There's potential differences between these metals in the foot and the mouth that I'll show. And I don't think we figured everything out, what it does at this point, but it's there, and with dramatic improvement after these metals are removed. So it's definitely something we need to look, further at here. So some of the things that I've had, muscle spasms throughout the body, fibromyalgia type symptoms, severe fatigue, joint pains throughout the body, headaches, migraines. Emotional health, suicidal type ideations with a number of these patients that don't feel they're listened to by their doctors, and then they're having problems. And it all started after this metal was placed in, whether it's in the mouth or in the rest of the body. GI issues, IBS, diarrhea, other types of things. This can exacerbate any type of rheumatological condition. I've seen it exacerbate where I've then removed the metal, and the swelling and the pain in the hands went away. Within a week after me removing the metal down in the foot or ankle. Paralysis issues, we'll talk about full body paralysis, and then nerve symptoms radiating throughout the body. And then reactions of pain or reactions between metals like I put in the foot and the ankle, and then let's say a back, one patient had titanium back hardware from a fusion, and chronic pain since that surgery. Then it was actually exacerbated after she had a total knee with titanium in it. And then I removed the stainless steel, which is a dissimilar metal, from the foot, and her back pain completely resolved. And she had it for a number of years since that surgery. And so that's what we have to really look at. And actually, it was Vera Stetskal over the immunotoxicologist who actually invented the ELISA test. She's from Sweden. But she was the first one to tell me about that, 10, 15 years ago. And then I started looking, and sure enough, because they'd removed dental metals, and pain associated with a total hip or knee resolved. And so that was quite impressive to me. And because the orthopedic surgeon said, hey, everything's fine with the knee and hip. There's no problems here that we can see on X-ray. And then they removed the dental metals, and that pain went away. So I think that needs to be
oral galvanism, right?
Well, potentially, that's my feeling is yes, that we are having some type of electrical potential or electrical current potentially, and that's what we're trying to prove with the engineers here, that go through the body. But something's obviously happening.
Look,
and I don't think
Scott, we are made of energy, right? The difference between an alive and an unalive human is electricity. It's energy, right? It's literally electric current. So,
right.
there are we know that water is highly conducive to electrical currents, right? That's why if there's an electrical wire going in a puddle and you step in that puddle, you can get electrocuted because it can transmit the voltage. So if we are 90% or 80 something percent water, it's a no-brainer to know that if we have an electric current going through, in some people, that might be exacerbated if we've got these metal rods in our body. I mean, again, it's we need to figure out how, because this. I think more than anything, before you continue here, is what breaks my heart here, Scott, is the amount of people that their doctors are like, they go all these symptoms and they're like, oh, but my work is fine. I know because I've done it, you've done it. It's like, your problem is a rash in the skin. Go see a dermatologist because it's nowhere near the root cause of the problem, right? Because the body, somehow we forgot to see the body in its entirety, that integrative concept of looking at this. And these people are desperate. And I've seen results like this myself. I really have. And that's why I know how important this is. So please keep on going, my friend.
Yes. Well, on that point, I had a rheumatologist that I'd already been working with. And I didn't even know this patient of mine that I did surgery on had a rash on her abdomen, similar to what this other patient I just showed you. She had a rash there. And so she said, she was talking to him, well, when did this come up? And he had the foresight to ask about the surgery and, and you're having that metal removed? Okay, let's just wait till after you have Dr. Schroeder remove that metal. That rash was gone in a week. By the time I saw her back 5 days for her first post-op, the rash was gone.
I've had one.
And she didn't tell me about it until the recovery room. She goes, oh, yeah, I had this rash, and it was gone. So, yes, exactly that. And we see this all the time with patients, with doctors just kind of say, my work is fine. That's why I brought that up. And it is. The work is fine. The doctor did not do anything wrong.
It creates,
right?
That's it. Didn't do anything wrong. Because what it does is it creates an existential threat to this entire community. I mean, I placed thousands, if not tens of thousands, of titanium implants, and I'm very proud of that work. And 99% of those patients, I wouldn't say 99, but let's say the great majority of those patients still have those structures in their mouth, and they're fine, and they're healthy, and they're good. You know, and but the problem is, we need, you know, medicine's in constant evolution. We need to be curious. We need to ask questions. There's more people sick than ever before. We see this. Chronic illness is on the rise. I mean, I think you saw in my lecture, I'm asking people to stand up that have autoimmune disease, cancer, or unexplained symptoms. Nobody, I mean, almost everybody's got something going on. I'm not saying this is one of it, you know, this is the everything, but it's definitely one of the things that I think is missing.
Well, exactly, and that's what we're just getting into now. Here was a paper put out by the FDA, September 2019, discussing all the different issues that can be associated with metals. And you look on the side, and there's cardiomyopathy and headaches, psychiatric symptoms, GI
Alzheimer's.
symptoms, Parkinson's. Yeah, yeah, exactly. All of this, and what actually is a better paper that this is a 149 page paper, but the best thing is just to read these tables, you know. But even I think even more concise than this, and this, you know, goes into a lot of different stuff. But this
Go back
particular
one.
paper, the Roche
Go
paper,
back one. Just
what's that?
go back one slide. Look at that.
Uh-huh.
Titanium, aluminium, hepatic
Yeah,
association with
hepatic dysfunction, anemia, encephal. You know, I
association with
mean, dementia.
Alzheimer's. You know,
Yeah, exactly. Right.
can I just ask you one quick question moving forward? Your titanium,
Yes.
the titanium plates that orthopedic surgeons use,
Mhm.
is it grade 4 or grade 5 titanium? Do you know? Is there a difference, or is it pure
Well,
titanium?
it's an alloy, so it's titanium 6Al4V. So it's 6% aluminum, 4% vanadium.
Vanadium.
Uh,
So that's what's happening so in dental implants. You've got pure titanium, which is grade 4 with no alloys, which is a bit softer, which is the gold standard, let's say. And then about 15 years ago, they started doing exactly the same thing to make them stronger by adding aluminum and vanadium, this alloy.
right,
So you've now technically got three different types of metal in one implant, plus the surface prep, plus a huge amount of them aren't clean according to the Clean Implant Foundation. And then you've got
right,
replica screws. Most clinics, they try and avoid the hefty costs of the abutments. So they buy replica abutments and replica screws. I mean, the industry hates this. Nobody likes to admit it. But instead of having let's say, the real branded, they'll buy a cheaper material for the lab components to save money. It's a big part of the industry. Some are good, but some are less good. There's very little oversight into that. So you'll have multiple metals in a big reconstructive case. And you were saying earlier, that study you were doing with the engineers, that the problem was with the interface of the abutment and the implant. And that could be because the quality of the abutment isn't the same as the quality of the titanium. But yep, people think they have titanium, but they also have aluminum and vanadium. That was the punchline.
Oh, well, and not only that, as you'll see, you know, because when we start breaking these things down engineering wise with ICP-MS, which is inductively coupled plasma mass spectrometry, you can break the metals down, and that's what we're doing with the 5 samples we just had yesterday. We'll cut off a piece, dissolve that, and then this particular machine can break it down into 1,000% weight. So in one of these cases coming up, you know, the nickel was 0.013% nickel, but that's what he was allergic to, and he had dramatic improvement after his back hardware was removed, and he had titanium implants. So, but he had like 14 to 17 different metals associated with that titanium alloy.
Let's keep on.
So you know, yeah, I would not say that you know, and these studies have proven out already that there's multiple impurities. And I spoke to the engineer yesterday about it. And he goes, well, it's just the mining process. When you mine, you don't just get a vein of pure titanium. It's all kinds of things. And so you go then try to purify that as best you can, but it's very, very, very expensive to purify it totally. So they don't do that. So this titanium or aluminum or vanadium have other impurities already in it just from the mining process. So that's what he explained to me yesterday.
That
Yeah.
is interesting.
And
So
yes,
it's
yes,
not
he had
by
it.
design, it's just by default. Okay.
Yeah, default. It's too expensive to. He had a zinc rod, and it was a few centimeters long, and it was 99.9999% pure, but it was $400 to get that for one of the studies he was doing. So yes, so that it's and then also just the process of making things. You're going to have impurities associated with that, but I think it sounds like the majority of them can come just from the whole mining process.
All right, man. Let's keep on going.
Yeah. Okay. So this paper, yeah. So what's good about this paper, people can look it up here, but this is out of the National Institute of Occupational Safety and Health here in the United States, and it's the Allergy and Clinical Immunology branch. And but this, if any doctors that have surgeons, dentists, that they should anybody puts metal in patients, they should have these tables and just read the table. This is another long, close to 100 page article. Most of it, a lot of it references, but just have these tables. And this goes through all kinds of these issues that can happen. Here's the geographic tongue, burning mouth syndrome, all of which I've seen, oral lichen planus. I mean, all this stuff. And it lays
just that as a dentist, we
Mm-hmm.
and I still think today, I mean, the burning mouth syndrome, the amount of people that suffer from this, that go to their dentist, and their dentist, with the best of their knowledge, up-to-date knowledge, will say it's an idiopathic syndrome that is multifactorial, and there's no known cause and no known treatment outside of steroids and this or that. There's, it's today, but I would argue that it's no one at school, at least I might be wrong here, I don't, I haven't gone into the recent education, but I doubt they're adding metal hypersensitivities to one of the causes of burning mouth syndrome. I don't think that
Oh,
that's not the first
yeah. Well,
step in the diagnostic.
well, in my gut feeling and in my world, that's one of the first things that needs to be looked at, as well as the electrical side of things.
I
The
would
galvanic
agree.
side of things.
I would
Because
agree.
I've had it multiple times in the foot. I have metal in there, titanium specifically, or stainless steel, and it's burning in the region. There's shooting pains from there, shooting pains all the way up to the buttocks. And I remove the metal, boom, gone.
Let's
So yeah,
keep on
it's. I
going.
mean, there could be nerve issues, but most of the time it's just related to the metal that I had in them. Yeah. So, and then I mean, this goes on. Allergic asthma. I've seen patients with asthma, and then I remove the metal, and then the symptoms, go away. And here's all the same type of thing. We get into all these different things, and you can see over on the right, rosacea, psoriasis, ulcerative colitis, irritable bowel syndrome, lupus, rheumatoid
Rheumatoid
arthritis.
arthritis.
Yeah,
Celiac disease, that's the gut, it's the skin. Sjogren, which is very, very, dental students spend a lot of time studying fibromyalgia. I am seeing all of this. IBS, irritable bowel syndrome. Now, this paper is published, peer reviewed, where?
Let's go back to that. And here is it's the Journal of Toxicology and Environmental Health,
2022
2022.
from the
Yep,
US.
yep,
Car Roach and
yep. From the
J.R. Roberts. So
yes,
the cat's out of the bag.
yeah. This article, and I actually contacted Roach and told her I was just so excited about this article because this has been a long time coming, and she was very gracious and all this, and she spent a lot of time on this, as you can tell,
What's her
and it's just
background?
incredible. She's actually in immunology, so she's not a MD. Yeah, I may be misspeaking, but I thought she was into research and all this kind of stuff. Yeah.
So that's
So
even so that, from an immunological perspective, that's okay. I'm very pleased to see this article. I didn't know
mm,
it was out there. Amazing. All right.
this needs to be in every doctor's office
I agree
who's doing surgery.
100%. I agree
Yep.
100%.
Yep.
And look, just for dental implant specialists out there, for the last 30 years, 20 years, let's say, the average failure rate for dental implants globally, almost unexplicably, has been between 5 to 7%. All right. Like you do the right thing and that implant
Good.
fails. Okay. What if this is behind it? That those, let's say so if it's let's say if it's 5%, that means that 95 can tolerate it. They develop other
Hmm.
symptoms, but 5% vehemently reject it. But
Yeah.
we're trained to think that there's no way you can't reject titanium because it's a biocompatible material, et cetera, et cetera. But what if this is, but that's what we train to, I mean, we only know what we know.
It is it is more biocompatible than other materials. That's a
But
better way
still,
to state that.
so
I spoke, yeah, because that's what I've been hearing for years. Oh, titanium's inert, titanium's inert. Well, I spoke to the engineers that work with titanium all the time, and I told them that the doctors have been told that titanium is inert, and they go, "What? Titanium is not inert, especially when it's placed in the body in electrolytic solution." And you were talking about water earlier. Well, just add salt and everything else to it. Chloride is very corrosive. And so he could not believe they were told that titanium was inert. And okay, more biocompatible,
so Scott,
not biocompatible.
I
Yeah,
would argue then that because I'm always trying to find appeasement on both sides of the fence. You see,
right,
um, I'm a dental surgeon. I love my brothers and sisters out there that have, everyone comes to the table trying to help their patients get their smile back, their health, their function. Some do a better job, some don't, some are, but at the end of the day, the industry is really just trying to help people, and we depend on the manufacturers and the universities to teach us to, and there has to be a measure of trust in the game, right? And,
right.
there's a lot of people that don't have an interest in this information coming out, right? But let's just say, for example, that if the 5% failure rate of implants is associated to this, I don't know, we'd have to prove that, obviously, but it could be, then there should be an interest in at least testing prior to placement, because when implants fail, it's very costly to the clinician. It's very costly to the clinic. Even that 5%, it's not negligible. So, like for example, the ITI, which is a very big study group, and they said that in Germany in 2022, 1.2 million implants were placed in Germany alone, with a 5% failure rate. That's roughly 75 to 80,000 implants that failed. That's a big number for the dental economy. It's not negligible. And somebody had to foot the bill. You're right. The patient, it's horrible. You have to go through the whole process again. A large amount of those had to have bone grafts to get it done. They had temporary teeth you can't chew. Aesthetical issues, emotional issues. Some people got sued, whatever. It's a huge amount of stress. What if they read this paper, understood that maybe they should test their patients prior to engaging and be a little bit more successful? I mean, I'm just saying that could be the beginning of a good argument to go where it hurts, which is that failure rate, which some people just can't seem to explain.
Right, right. Well, I agree. I think that is one thing, as far as that goes. And actually, this leads right into this. 5 ways metals can react negatively in the body. I changed that really to 6 now. But physical are just improper placement, impingement, what have you, infection. We always got to rule that out. But then toxicity from excessive metal ion release from wear and tear and or corrosion. Okay. But then, yes, we're dealing potentially with allergy or hypersensitivity. So that's another thing, and that is one thing that can be tested for and ahead of time. And we definitely need, in my opinion, if I have my spouse or child or parent is going to have a total knee or hip that's supposed to be in the rest of their life, do I want them tested prior to that? And for metal hypersensitivity, so we know what they're allergic to prior to this big procedure. And I think it goes hand in hand probably with what you're talking about too. If this dental implant is supposed to be placed the rest of their life, should they be tested prior to make sure they're not allergic to one of the metals associated with that? And then we're looking at the galvanic electrical type reactions that we'll be talking about here in a second. And then the other one is EMF. And I've just been seeing too many cases lately coming out with reversal of things. Like one of the professors that I was working with, she couldn't hold her cell phone up to her ear. Her face would go numb, and she had these different dental metals. Actually, we'll show some of these coming up. And after she got all that out, she can hold her cell phone up to her ear now without her face going numb. So, something's happening there, and I don't think we have a total handle on it. And yeah, I've just been working with a bunch of different docs and corrosion engineers and dentists and everything around the world here. This particular, I try to run through this one pretty quick, but this is just a stiff person syndrome. This patient, I operated on him, put some stainless steel screws in his feet, and he ended up with paralysis. And these are just the screws, the small screws in his feet, but he had paralysis up to 10 hours a day, where he could breathe, but he could not talk and could not move. And he was an engineer, actually, and he didn't realize that it came on 3 months after the surgery. So he didn't realize it was associated with the surgery. I didn't know, because he had left the practice because everything healed up, and he didn't have the symptoms prior to me doing the surgery that he had. So then he came back, and his big toe started having a problem. So I had to, and that started curling. I was going to have to fuse part of the big toe, but I noticed all the swelling around these screws, and I go, well, I'm not sure what's going on here, but we don't need those screws. The bone's healed. Let's get rid of these. You may be allergic to nickel. And I used titanium in the big toe. Ultimately, had titanium or problems with the titanium. Had to remove that too. But and he had seen all kinds of people, University of Washington, Mayo Clinic, and they just said, "Sorry, you'll just probably be in a wheelchair the rest of your life." And this gentleman, this started in his 40s, and he said, "Your wife will have to put you in a nursing home after a while because she won't be able to take care of you." And so I removed the screws, put titanium in, but also removed those stainless steel screws. He went from being paralyzed 10 hours a day to 3 hours a day overnight. So he goes, something's going on here. So then we sent his blood off for ELISA testing. He was positive for nickel, as well as highly, highly positive for palladium. Well, you being a dentist would know where that could be. But I had no clue. And so, I'm looking at palladium, and his gold crowns, he had 2 gold crowns, and he had some amalgam fillings, and his gold crowns were 26% palladium. So he worked with his dentist.
Yeah.
What's that?
Just for people that aren't that specific, when you have a gold crown, it's not always pure gold, right? So there's can be alloys to make it a bit softer and malleable, and one of those could be palladium.
Or stronger. You want it stronger, right? And tougher. Yeah. And so in his particular one had his palladium, so he ended up the day he got his last gold crown, he got all of his amalgam out. He also had an ACL repair in his knee and had a titanium screw in there. The day he got his last gold crown out, he hasn't been paralyzed since.
Wow.
And I've speaking to him for a number of years now, and he's still, no paralysis. And that was the first case that really, directed me from the foot to the mouth. And then I really started paying attention after that. And and here are the small screws in front there. Those are the ones that paralyze him, and that's the simple. ACL repair screw. What's that?
What's that big screw?
That's the ACL titanium screw. So they replace the ligament, and then they use that kind of as an interference screw to screw down in, and then the ligament heals into the bone, and you don't need the screw anymore.
And the smaller ones are made of what?
Those are stainless steel.
Okay.
So they were about, stainless steel is anywhere from, in the 14 to 16% range of nickel, and he was allergic to nickel.
Got it.
Yeah. And you can see the ring on his hand, right?
This guy's
not metal.
Yeah.
So, and he had to be careful of what he ate and everything also, So this was just a teacher. I don't know if you want me to go into some of the voice memos I have or not, but
I think leave one for our listeners.
Okay. And so you do want one for the listeners, huh? Okay. Yeah. Well, there's actually some coming up. This one's a pretty impressive one because this goes directly between the foot and the mouth also. And so I'd seen her, she had stainless steel screws in her feet when she was 16. And then I had to do some other work and noticed, like you were talking about, that's one of the first things is the earrings, She had problems with the earrings. You go, oh, well, most likely you're allergic to nickel. So let's don't use I'll take those stainless steel screws out. We'll use titanium. We did. She did fine. Then she came back and I said, come back if you have any problems with these screws. So she comes back later. Oh yeah, these screws are giving me problems. Can you get them out? Sure. And then I'm doing the pre-op and I'm looking at all her medications, all these huge list of medications. I go, what's going on? And she goes, oh, those are from my fibromyalgia. Well, how long have you had fibromyalgia? Well, about 2 years. And I go, what else you got? She goes, oh, I got the severe fatigue. I'm a teacher. I'll send the kids out for recess and I'll sleep under the desk. And I'm going, well, how long have you had that? She goes, oh, about 2 years. I go, you have any other metal in your body? And no. Well, do you have any dental metals? And she goes, nope, never had a cavity. And she goes, oh, but I have this, bar behind my teeth. I go, oh, you had braces. I go, when did you get braces? She goes, oh, about 2 years ago. I go check with your orthodontist, see when you got your braces. So she goes in, calls him back later that day. Oh my God, I got this. I got my braces in August, and beginning of September is when I started having these severe fatigue symptoms and the fibromyalgia came on. And so anyway, we go and we go and get the screws out of her feet. Okay. And this actually I presented to the FDA back in 2019. I presented this particular case. And so let's go ahead and we will listen to her and you can hear her story.
Okay. Around 2016, beginning of, we were having some symptoms with the screw, so we decided to get it out. And then we realized you were having a number of different symptoms, some fibromyalgia type symptoms. You were diagnosed with some chronic fatigue, and we decided to get you metal tested, found out you were allergic to titanium dioxide and nickel and vanadium, both of which titanium dioxide and vanadium were then the titanium in your foot. So we decided to get that out. Also, you had a stainless steel bar with 15% nickel behind your lower teeth. So what happened after we got the titanium plate out of, or titanium screws out of your foot?
So almost immediately after you took the screws out of my feet, I noticed that almost all of my body pain and my migraine symptoms had gone away. And within a couple of weeks, actually all of my rosacea had cleared. So I was able to stop most of my medicines within a month. I think I was taking 18 different medicines for fibromyalgia at that point. And then shortly after that, I made an appointment to take the bar out from my teeth. And since then, I take one pill a day for my migraines, and that's it.
Okay, thanks.
So what do you think about that?
Unbelievable. And probably the migraines could be caused because there's a lot of evidence that shows when you do orthodontics without controlling the occlusion, you can offset the TMJ because basically you create a premature contact and that can create tension headaches. So she might just need some calibration of her occlusion and she'll be fine to go. But oh my God, that's unbelievable.
I mean, dramatic.
Just wait. People, dentists are going to freak out when they hear this, right? Now, as you know, I run a practice. I've thousands of patients that have metal bars in their mouths with no problems. All right.
Mm-hmm.
So no visible complaints, and in their medical chart, they're not taking any medication. They're healthy. They're active. They don't have rosacea. They don't. So how do you explain that?
Yeah, well, I think again, you have to know what questions to ask. Okay, and you have to look at the whole big picture. We can't just focus on one little thing. As foot and ankle surgeon, that's what I was doing. I was looking at the foot and ankle, and okay, yeah, they have headaches and they have fibromyalgia and neck pain, but hey, that's not me, right?
Right.
But what I'm saying is, it could be me, or at least coming from the work I did. I need to ask the right questions. And then you really need the proper history. When did these things come on? All her symptoms came on after she had her braces.
Look,
but then that vast majority went away when I removed the titanium from the foot. That's very telling to me, that, hey, there's a problem going on between these two somehow.
Look, I mean, I've like I said, I started seeing this about a decade ago. I would argue that, you're completely right with what you say. I have done the metal removal of some of my patients that have desperately been trying everything. and seen immediate results like you. I had one guy, he had really bad eczema all over his skin, under his armpits. And after removal of the metal, because we did the tests and all of that, within 2 hours of the surgery, the redness went away about 80%. Within 2 hours. Like I was still suturing and he was already having improvements. It's and he was a redhead. Now my mother's a redhead, and we all, I don't know if there's anything to do with that, but some people are more sensitive to this than to others, but that doesn't mean that it doesn't affect everybody. So I guess my question is, do you think metal's bad for everybody?
That's the question. I don't know. I don't think so. As far as what I've seen in my patients, because I've had the same thing. I've had patients, and I've asked questions later, about patients when they come back in for something else. Oh, you have any problems with that foot? And then the surgery we did. Any other symptoms in your body? No, 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 no. So no, I do not believe it's everybody by any means. Why? And I don't think we have that question answered totally. I think, do we need to study that? Yeah. And because it's going to only help people. I think right now we just need to have a high index of suspicion, and we
An
have to ask
awareness,
the right
an
questions.
awareness around this topic. Because I think most folk that are in the healthcare sector really, truly, genuinely want to help their patients heal, right? I mean,
Right.
a huge part of the industry has gone into the financial aspect of things. I understand that, but most surgeons are good people, and they're like, they want to help their patients. I mean, if you're still in the game, I guess. So I
Right.
think what we're doing is we're just adding an extra tool of to help you at least think, well, hang on, if you've got that and you have that, maybe it could be this, and if you get it out, I mean, you don't need a metal wire. It's easy, it guarantees, but you can always have a retainer at night, metal free. Thanks to 3D printing, you can have metal free retainers for your aligners. You don't, for orthodontics. We have alternative to titanium. We have ceramic, zirconia ceramic implants. So there are alternatives. We stopped using gold in dentistry many, many years ago for composite and high quality ceramics. So I went metal free as a dentist in 2006 in my prosthodontic cases, pretty much metal free.
Mm-hmm.
Naturally, we still use titanium bars and titanium implants, but we do test our patients, and we always mostly use grade 4 titanium, so alloy free when we do, and of course, clean implant certified. But this makes me obviously, and since I saw your lecture, we always ask, do you have metal plates in your body before we go ahead and place another implant in the mouth? So let's say a patient's got no metal in their mouth. I always ask, do you have any metal in your body? Exactly because
Yeah.
of this slide, because it can create a current. So talk about this a little bit.
So yeah, so that's where we're going into. Oh, just one point on that. I was just talking to a dentist about, because I was concerned about the stainless steel bars, because all three of my daughters had those, and two of them had significant reactions that we didn't even know were associated with that. One was IBS type thing, and the other was a rash. That the rash resolved within 3 days after removal. But he talked about Kevlar. The lingual bars potentially, just have them made out of a Kevlar type material instead of having to use the stainless steel. Probably more expensive, I don't know, but there's one way to potentially avoid that.
Cool idea.
Yeah, yeah. So here we go into the positive. There's all of these metals have their unique charges to them. You look at the periodic table, okay, and the more positive metal is more of a cathode, and more negative metal, more of the anode. And it's going to be the anode metal is going to be the one that's going to corrode faster. The least noble metal is the one that's, and then the positive metal or the more noble metal is more protected. And all metals in the body will corrode, just period. It's it's the rate at which it corrodes, and it may take a long time. But this is where I'm concerned that some of this may be accelerated. If we have some of this type of galvanic reaction going on, and if we do, it's basically a battery type reaction between dissimilar metals in the body. We have the cathode and the electrode in the middle are the body fluids and the anode. And so that can create a battery. And then we look at the body and we go, okay, here is an action potential of a nerve. The resting state is minus 70 millivolts. And this nerve will fire off at minus 55 millivolts. And we don't know how this exactly relates to what I'm going to present to you, but this just tells you, hey, we have electrical things going on in the body. And then, like you talked about earlier, how much of the body's function involves electrical impulses, or chemical electrical, pretty much the vast majority, right?
Unbelievable.
Yeah.
So, show me about this. Yeah, this is what I want to. This is what you sent me that really.
Yeah. So this is where I actually, when I presented the FDA, I did a similar type one. I redid this for this presentation, but and came up essentially with the same thing. But I was thinking I was having a problem between the foot and the mouth. So I go, how can I try to prove this scientifically? Because I'm like you, I want the science behind everything. So I went to my neurologist friend who does a lot of diagnostic testing. And I said, hey, can I use some of your equipment to test this? He goes, well, actually, what's going to be better is you get a high quality multimeter, and then use ultrasound gel, because I wanted to test titanium, like titanium plates and stainless steel screws or what have you, against each other to see if I'm seeing some potential differences between them. So here's a titanium plate on the right, stainless steel screw on the left. And here we are at 151 millivolts between the two. And I'm going, whoa, okay. And again, I don't know how it relates to how the action potential of a nerve fires off, with just really about a 15 millivolt change. But here's a potential between these two. And so I go, well, I think I'm having a problem 6 feet away. So actually, in the FDA presentation, I presented the good old Hot Wheels.
Okay.
You got to be thinking outside the box a little bit, right?
I love this.
And and it's still 68 millivolts.
That's not insignificant. That's enough to disrupt. That's enough to disrupt cellular activity. I mean, it is.
That's what we got to figure out totally, and especially when you're up in a lot of these that I'm seeing is, well, as you'll see here, in the body. Well, when I presented the FDA, where a group of us were talking, and somebody said, boy, we should figure out how to do this in vivo. And I go, I think I can do that. And so, because I have my own surgery center. And so I went ahead and I just had to figure out a way to get a sterile probe for the foot. And I just used a cautery probe that we use all the time, cut off the end that can hook into the voltmeter. And then we were good to go. And we could sterilize the other end. So here was a lingual bar. Okay. And then titanium, I had titanium plate and screws. So anybody watching, just be careful. These are some graphic signs of surgery here. So just be careful if you're a little queasy. But this is titanium that I had in the foot prior to removal. And so minus 158 millivolts from the foot all the way to the mouth. And the positive negative it just depends on where you have the positive probe, negative probe. So,
and that's from a lingual bar for orthodontic, end of an orthodontic, just the bar that the orthodontist place after orthodontic treatment, correct?
Correct.
So that bar is not in the bone. It's not in the bone. It's not under the gum. It's literally just against the back of the teeth, correct?
With saliva, yes.
Everybody's got
saliva around. Right.
Good.
So then I remove the plate and screws, and then I go to bone or the soft tissues, and it was 35, millivolts. So we had a difference of 193 millivolts.
That's significant.
Okay, a difference. That's what I believe. So in some of the studies out of Russia.
Sorry to interrupt. There's something that's freaking me out, because there's a huge part of the population. These people would be mostly between the ages of 55 to 85 that have partial dentures that have a chrome cobalt infrastructure, metal acrylic partial dentures with these metal clasps. So my concern was always structures that were under the gum in the bone, because there's an implant surgeon, or fillings inside the teeth, right? Or crowns and stuff. I hadn't really thought about this. So the amount of people that have these external prosthodontics, like removable partials with a huge amount of metal alloys in them, that probably also have, so it affects if it's just in the saliva. Oh my God.
Well, that's the saliva and blood and interstitial fluids are all the electrolytes, right?
Huge part of the population, Scott. Huge part of the population.
Yeah,
They're huge.
yeah. And I was talking to one of the engineers, corrosion engineers that actually work with some of the orthopedic appliances, metals, and that type of thing. He goes, yeah, then you have a reaction between the mouth and the foot, plus then the total knee, and so you have all these different reactions potentially going on, right?
And no one's asking that question because as you saw, my lecture, the doctors and dentists just don't speak. So the likelihood that an orthopedic surgeon and a dental surgeon ever speak on stage or ever share the same room is almost zero. That's why I'm loving speaking to you. You're an orthopedic surgeon. We do the same thing, just somehow magically the mouth isn't part of the body, so that's being
that's exactly why I came to meet with Jack Call and others. He was the one that asked me to present to the FDA, their group, their board.
Very grateful for this, Scott. Keep on going. Yeah. I love this. Keep on going.
Okay.
I'm scared of what
here is gold. Gold to titanium, and gold. One of the more noble, right? Well, here it is. So here's to titanium, right? And a screw in the toe, 340 millivolts. 340 millivolts. And then so I take the screw out of the foot, go to the bone, minus 37. So a 300 millivolt change. And that was very consistent what I saw with gold.
And the patient's symptoms are like the one in the voice note, just like my symptoms improved dramatically overnight, kind of.
Not everybody. This particular gal, see how swollen those two toes are versus the third toe, right? So I took these titanium screws out of these. By the time she came back 5 days later, the toes looked very similar to the other one. Right. The swelling just went down, the redness went down, inflammation associated with that. Now that could be just from localized titanium. Is it related to the gold? I don't know. But it is, we got to ask the questions, and try to, figure out what's happening here. So, and these were just, she had a gold crown. Let's test to that, and see. And some of these also have amalgam, and so I test to that, And so this is one, this is a recovery room nurse, significant issues, mentally and emotionally and all that, as well as body pains and everything. But here's her titanium to amalgam. Here's her amalgam. And so she was minus 154 millivolts. I go to bone, and then she's 7, so she's 161 millivolt change, right? And that's to the amalgam.
Amalgam has a bunch of other things. So it's copper, silver, mercury. There's 3 metals, right? So
right, and potentially nickel and others too. Well, what I'll have you do, just because of
actually
with her, with
the reason why, sorry to interrupt you, the reason why amalgam fillings are so brilliant is that they actually corrode, and it's the corrosion that kills bacteria, making them last forever. So that actually is something that we study. So they're actually designed in the interface between the filling and the tooth to leash that corrosion that that would actually, it's part of their reason why they last so long. At least that's how I remember it. I haven't used them in 30 years. So
yeah. Well, and we have some things coming up on that too. But so I'll have you listen on her to some of the emotional sides.
We removed multiple titanium plates and screws from your foot. And how do you describe your emotional state prior to the hardware removal?
I was highly emotional. I was very labile. I was depressed and cried. And 75% of the day I was crying. And I had my husband's big hanky and cried myself to sleep every night. And would wake up in the morning and out my eyes, and I was so sad. It was just hard to even carry on to continue to live.
And since getting the hardware out?
I feel brand new. I feel alive. haven't cried in 2 weeks. it makes me cry to even think about that. I mean, I'm happy.
Right. Okay, thanks.
So that's some of the stuff I've seen with these emotional side of things, and anxiety, that type of thing after I
Yeah,
remove the metals.
perhaps
So what are your thoughts?
you've got millions of people taking SSRIs, antidepressants, Zolofts, and Xanax, and all of that stuff, dealing with mental health issues, and they might be oblivious to this issue, and it could be just cured overnight. I mean, mental illness is a multi-billion-dollar industry. It is an industry, and so many people suffering, leading to suicide ideation. And it could be something as simple as this. Professor Edward Bullmore from Cambridge University published a book in 2012 called The Inflamed Mind. And basically, he published findings. I actually had dinner with him, a lovely guy. And
good.
basically, the theory was that anxiety, depression, panic attacks, all the way up to dementia wasn't just caused by sadness, let's put it that way, but actually by cytokine, chemokine passing the blood-brain barrier. So if you have systemic inflammation, those chemokines and cytokines pass the blood-brain barrier, activating microglia and disrupting brain activity. So, of course, that be perceived as sadness and depression and all of that stuff. So if you remove the root cause of the inflammation, whatever that may be, then people get immediately better. So Ed's book, if anybody wants to read it, The Inflamed Mind, proves this. So what you're seeing here is a current that could be causing inflammation that could then be also, I don't know, we need to look into this bigger, but I mean, wow.
Yes, I think the current can be involved. I also think then, because if we're looking at the current going between the two or having an issue between the two, and we look at the positive negatives and the anode and cathode, like with stainless steel 316 that we use versus amalgam, at least according to a number of the reports that I'm looking at, is that the amalgam is is the anode in this case. And so then now that's going to get released more, and then into the body. And that's my concern, because a number of these patients I'm seeing, they also have amalgam. So with the more emotional issues. So are we then, as the titanium, then allowing the amalgam then to be released more readily,
it's
contributing to it?
I'm just remembering right now. I remember I had a friend about 20 years ago, and she didn't want to get pregnant. She didn't want to take the pill, and she had one of these intrauterine devices placed, and it had a coil in it. I don't know. I'm not a gynecologist, but I remember her one day. I didn't know she had it. She was a colleague of mine, and back in the day, many years ago, and I remember her like just crying all the time and like depressed. She was always a happy person, right? And then just one day, like her mood just, and she's like consistently crying and sad and depressed. And I was like, what did you do? Because I'm a very curious. I'm a doctor myself. I'm very curious. And I said, have you done anything recently, like in the last month? And she said, I had this thing device, and then I was like, and I knew it had metal in it, and I said, well, just take it out. And that was just instinctive. That wasn't. I said, well, if you were happy before that, take it out. And I remember her. She took it out. And the week later, she was back. She was back 100%. So she must have. I haven't thought about that in 20 years, but she probably had that the metal allergy to the coil in the intrauterine.
Well, and they had many problems. There's one device called Esure that is nitinol, and it's 50% nickel. And they had significant problems with it. I believe it's off the market now. But yes, there's called The Bleeding Edge. It's a Netflix documentary that discusses this specifically and all the issues and that type of thing. So, that's what I'm talking about.
What do you tell somebody? I've got a patient, and she came in for checkup, and we run the metal hypersensitivity test. Have done for many years, and she's off the charts for titanium, off the charts, and vanadium, and yet she's had a back accident, back injury. And she's got a bunch of pins down her spine. And like she can't, I don't know, I'm not a spine surgeon, but basically can't take them out because there's no alternative in another product, let's say in ceramic and or PMMA or PEEK or Pecton or something like that.
Mhm.
You know, how can these people find hope if they've got this problem? I mean, are there, in your experience as an orthopedic surgeon, are alternatives to metal on the rise?
Yes, I mean I've been trying to work with some of these companies, to see what else can be. I get paid for nothing, and I never want to be paid for any. Like say, some of these companies will ask me to lecture for them, and I go, no, I'm not going to do it because I compromise myself. But but I encourage them as far as that goes. And spine is a big thing. I get again, that's not my specialty at all. I'm foot and ankle, but metal is, and I've had to work with and talk to spine surgeons, neurosurgeons about, okay, we know that this particular patient is allergic to, metal, but that's all I have. And I go, okay, well, you just have to tell them that, and I speak to the patient too, that you may have some symptoms during this, and she did. But then he was able to get it out, and then all the symptoms went away, and her original problem was gone too. But with some of those fusions, after fusions, many times if it is a fusion, then many times you can get the metal out. It just depends on where, like if it's coming in from the back and everything's fused, then you don't need that hardware anymore.
And
And
we're also
like the
seeing
case,
we're seeing in the hip replacement, like ceramic and polyurethane are basically pretty much taken over, right? You're not placing metal that much anymore, right?
oh no, you still no, hips still have to have a metal,
Screw that goes in
construct
the head, right?
to support that. Yeah, so the head can be ceramic, and then yeah, there's the poly. But there's still, knees. They do have some over in Europe that are, kind of total ceramic type knees, but they still have to cement those. My understanding right now. So that the total knees and hips, the hips are behind the knees a little bit, but still, vast majority of them still can contain some type of metal. They're working to ceramics more and more, but I don't think we're where we need to be.
So basically, if you can't have any, if you have the hip, if you have the knee, if you have other metal, then ideally no metal in the mouth, right? I mean, if you have
Right. Yeah.
chronic health issues,
Exactly.
if you have chronic,
Exactly. And that's what I'm, yes, that's what I'm seeing. Like one gal, she had titanium hips placed. She had all kinds of pain problems, mental issues. She had stainless steel in the foot. I removed the metal from the foot, the stainless steel, and her hip pain dramatically improved. Her emotions dramatically improved. And again, I think it was just the reaction between the two. She could still keep the hips, and that's where I'm saying with surgeons that these patients are having problems, don't, and the surgeon says, hey, the knee looks great, the hip looks great, look elsewhere in the body for another metal that potentially you could get out much easier without having to address the hip or knee. And so I mean, you take out the easiest metals first. That's what I always tell people.
got it. All right.
Yeah.
So, do you have any other stuff? Okay, so what else have you got there?
Yeah. So here is this. Yeah, so here's another whole part of this. Then is all this corrosion, right? And working with the corrosion engineers, like I say, I was just up there, and here was this clip. Here's the penny, and here's a clip down here. This is a gallbladder clip, and this patient was in a wheelchair majority of the time. And here was the titanium clip, and here's the corrosion under the scanning electron microscope that we saw from this titanium clip. And so and we're seeing this quite a bit with these
And that
gallbladder
obviously
removals.
has leached into the body, obviously.
Correct. Yeah. So it can go throughout the body, and the patient was allergic in this case to nickel. And after removal, significant improvement. She also had titanium clips in her thyroid and had those removed. And after both these were removed, dramatic improvement in health with this particular. And then here's another, like you were talking about. This is from back surgery. And this was his titanium hardware. The arrow points to where this picture comes from. And this is corrosion of the titanium back hardware. You can see the normal striations to the left, the milling process of the titanium, and to the right, that's all corrosion. And where did all those titanium, including vanadium and aluminum and nickel and other things, go? Where did that go?
Oh my God. Yeah.
Yeah, throughout, it's throughout the body. So the whole inflammatory thing, this can, aluminum can cross the blood-brain barrier. You talk about the inflamed mind.
Alzheimer's.
I mean, it all can
Alzheimer's is through the
yeah.
roof. I think Alzheimer's is
Yeah.
one of the leading causes of death now in America, right? Up there with.
I don't know specifically on that, but but yes, I mean, all of this we have to look at. And then here's what I was talking about, inductively coupled mass spectrometry, where we can look at all the elements from that particular those hardware. Look at all the elements, that were in here, including, not just titanium, aluminum, and vanadium, but you can see the concentration there, but also chromium, iron, nickel, and then a whole host of other things up there, of trace amounts. So that's all kind of that. I think we're back to that mining process and that type of thing.
That was
and then the nurse we just listened to. This was her plate, titanium plate, after just about 5 months after I removed it. We took and looked at that under the scanning electron microscope, and this is this is the bone side of one of the small plates she had after just 5 months, and this is the corrosion. So what do you think?
And then, of course, you've probably got different, like in dental implants, you've got, I don't know. Thousands.
Yeah, well, the dental implants.
Thousands of.
I've been
different manufacturers.
Right. Well, we've been looking at that. Yeah. But the coating, it's HA. Is that one of the coatings?
We've stopped putting hydroxyapatite on coatings. That there was a phase. Now it's usually it's called SLA, so it's acid etched and sandblasted for let's say more surface adhesion.
Okay.
We stopped using polished titanium many years ago. So there's like a roughened surface which is etched and sandblasted.
Right. Okay. Well, that had to be looked at too. We've looked at some of the HA ones, but the HA kind of coats the implant into the bone, so we can't really see underneath that very easily. We haven't figured out a way to get it off. But this was, again, people want to kind of be careful looking, but this was all titanium. This was after about 4.5, 5 months of me removing a titanium plate, and all the black. I've sent this off to pathology, comes back as titanium particles.
I've seen this in the mouth. Once having to remove a fractured titanium implant, I have seen the corrosion in the bone. I've seen it. And I think Sam Bussi has an article on that as well about titanium particle corrosion, published a few years ago. All right, man, listen.
So good.
That's just it's so what do you think needs to happen at universities, in policy and hospitals, at this?
Yeah. Well, I think we just really need.
This you're showing me right now, I see every day. That's a metal screw, an amalgam filling, and a porcelain fused to metal alloy crown.
Right.
That's dentistry from the last 40 years. It's there.
Correct. And so we took this one on the left, the amalgam, the chunk of amalgam, and this happened to be a stainless steel, root post. And here is what it looked like under the microscope, under the electron microscope, and this was to the left. That was the stainless steel root post that then was attached to the amalgam. And you look how kind of rough everything is there, And so that's what we don't know. We want to get a new piece of amalgam that's just formed and just see how much of this amalgam potentially has corroded away, or is this just the way it looks when it comes out after it's formed. And so then we looked at, this was the amalgam itself, and it was mercury and silver in this particular one, and that's with what's called EDS. And then here was same type of thing. We were looking at this was the root post there, and then this was actually the crown. The crown, and the metal of the crown was palladium. Okay, and palladium is more noble than the mercury. So, and these are right in close proximity to each other. So again, we can get a battery type reaction. And what's going to be released? Well, the mercury is going to be released, right? Because it's the more anode.
And that's just physics, period. There's
this is just physics. Yeah, this is physics. This is engineering.
can't argue that. So it's just not going to not happen. It's going to happen.
Right. So yeah, I thought you'd kind of want to see that one, and then this may be interesting too. Just briefly, stainless steel to titanium implant, 111. Here's stainless steel to a zirconia implant, 0.1 millivolts. Titanium to titanium. Titaniums are alloys. They're not the same.
Go back.
Which one?
Ceramic. So this shows you that zirconia is probably the way to go in the future, right?
That's my gut feeling looking at this, especially electrically. Yeah, it doesn't, there's not a reaction electrically. Here's the titanium. And this is my gut feeling as to why we're having failures. You're having failures, or the dental world is having failures. Is that here's zirconia, and there's titanium, and so you definitely have electrical issues going on. And then if you have other metals in the mouth, and then we're sitting there looking, okay, here's again titanium to zirconia.
No one is aware of this, Scott. This is so important. Honestly, I'm going to make sure.
And then here, yeah, and here's titanium implant to titanium implant. And these were ones I believe Sammy gave me to check it out. So these are different companies, right? And again, they're not the same alloy. So you're going to have a potential difference between. So if you put one titanium in one place and then another different brand in another place, you're going to have reactions just between those two potentially between those two titanium implants, potentially, right?
Keep on going.
Okay, yeah. So here's titanium implant to zirconia, all right? And then here was the gal that worked with the FDA. She presented to me with the FDA. And so her specialty was this adverse events reporting. And of all the medical implants, including total hips, knees, everything, it's 25 million. Here's the staggering one. Through April 25 of this year, there's 5.1 million adverse events reported for titanium dental implants. So 1/5 of all.
Events. What's organization is this? This is at the FDA.
No. Device events. Madras broke off from that, and then there was a couple. There's what's called the MOD reporting that she has listed there, and then there's another type of database, and she combined the two to then get this quote device events. And she works with a lot of universities.
25 million from dental implants.
No. 25 million of all devices.
And what? Okay. And then
all
dental
medical
implants,
devices.
how many?
5 million of those.
5 million. That's a big number. And are these numbers just from the US or globally?
These are what are reported to the FDA, and my understanding is that this is because because the companies that most of this reporting actually comes from the companies. When a dentist has an implant that fails, they send it back to the company, says, hey, this one failed. And as you see at the bottom of this, it says 4.4 million of these were serious injury reports. And basically what that means is it's lack of osseointegration. Okay, that's what the 4.4
So that could be these 4.4 are those, let's say, 5% that fail. Now,
right.
We could tap into the greed of the dental industry and say, hey, because they have to replace those implants and the clinics have to replace them. It's a very expensive proposition when these implants fail because you lose the crown. It's horrible. Nobody likes these failures. Maybe that will inspire people to start asking more questions and looking into this a little bit more. Jeez, man.
Right.
That's a little number.
That is a big number, and that's what these corrosion engineers were. Boy, we need to look at this further, and they're willing to work with the dental industry regarding this, to try to figure out why. And then this was actually the HA on this in the upper right is that titanium dental implant, an older one, but this was actually, I was talking about the abutment. So it's the abutments where we're seeing the issues. Here's the corrosion on the abutment that's screwed into that older dental implant. So you can see the corrosion in the center aspect. And that makes sense because that's where you have more of the fluids and all that around there, right? And and again, we're just delving into this now. So, but I think more work needs to be done here. So, and then we looked, and sure enough, this was titanium. You can see this EDS, it's called, and it's the aluminum, titanium, and actually nickel was in this too. So,
in the abutment.
But then here's the reports for the FDA with the the dental implants and happening in the last from 2019 on is when it really took off as far as more serious events here.
Interesting.
Yeah. So, and then I'll just kind of put this in so people kind of look at it real quick, because this is the lack of osseous integration and what have you, and some of the other issues associated with this. But that's what we got. And so big thing is going to be working with having a high index of suspicion. And really looking in, asking the questions, and when there are issues, and maybe a little forethought going into some of this now. It does appear, if we can have good ceramic implants, in my mind, from what I'm seeing from my at least electrical type stuff, that seems to be a way to go with this and avoid, and that's what we're trying to do in the orthopedic world too, with a number of these issues, is find other alternatives. As opposed to the
but I'm going to tell you something. First of all, thank you for this. It's brilliant the way you educate and explain and back it up with your experience, but also the publications and stuff. And it's very simple. It's very on point, and it's scary. A normal dentist that does this, it's going to scare the living shit out of a lot of people. All right. And I would say that, it is a duty of every doctor, every medical professional to continuously be curious and ask questions and challenge the status quo and educate themselves and follow the science and the literature. And I think this is, nobody can ignore the rise of autoimmune disease, unexplained conditions, chronic health issues, subclinical issues that, the amount of people that are on pills, just like the ones that you said that are desperate for help. And it could be something as simple as we have just overlooked electric currents that were created by putting metals in people's mouths. We didn't know. We were trying our best. And, 100 years ago, we'd make lead piping. We put asbestos in people's ceilings. Doctors were recommending smoking to pregnant women. Medicine is evolving. It was done with the best of the knowledge, the best of intentions, and we need to evolve. So I'm going to make sure a lot of my colleagues see this. They might want to reach out to you.
Yeah.
How do people find you?
So it's right now I've been kind of laying on the low a little bit, just because with how much I'm doing and working, it's probably best to kind of come through you, and then you kind of be able to get people
and
on.
Also, very clear, Scott, you don't have any devices, you don't have any shares, you are not paid by any organization, you have no fiduciary or financial interest in any company in healthcare outside of just you want to help people see what you're seeing.
This has affected my family. 4 of my 5 family members, including myself, have been affected by this quite significantly. And so, you have that type of thing happen, and you flip, you change, you kind of really start asking questions. And, both my mother and father, same type of thing, Alzheimer's, dementia issues. I'm concerned about when I'm going by the group homes and people are screaming and yelling and all that. Okay, do they have amalgam in their mouth? It's a neurotoxin, right? And what's happening? We look at this, like you mentioned, the psychological, issues in this country. Let's ask a question. What metals do these people have in their body? And can that contribute to these issues that we just looked at that article, that yes, all of it can be related to metals. Okay, let's just rule that out then.
I'm going to do my very best to see if we can get you on guys like Joe Rogan, who have huge reach, these big podcasters, David Huberman, these big guys, because I think I introduced you to Layla the other day in Miami. They know a lot of big names because this information needs to get out there, and you need to work with the companies. We need to find solutions. We need to help people. Listen, Scott, I can't thank you enough for finding time for me and to jump on this and educate. I'll get this up as soon as I can. And God bless you. Keep up the good fight. Keep on asking questions. And I look forward to sharing the stage with you again real soon, my friend.
It'll be great. Yep. Always a pleasure, Miguel. Thank you very much.
Very much.
Appreciate it.
All right. Thank you.
Okay.
Okay, don't hang up.
You bet.